So my big takeaway, I would just say, if you can remember what are your hopes, what are your worries, asking that to your loved ones is really going to get you a long way.
Welcome to Better Together podcast, produced and directed by our Hospice of South Central Indiana, a not-for-profit dedicated to making every moment count. We will share true stories about hospice, palliative, and personal care services that we provide in 22 counties all over South Central Indiana. I'm your host and president, Steph Cain. We are joined by Dr. Anderson, our hospice and palliative care medical director today. Dr. Anderson, hey, welcome.
Thank you.
First question is, how do you feel about Indiana sports?
Oh, man, I'm a Boilermaker, and I can't speak for all Boilermakers, but I was rooting for them. I love to see Indiana sports do well, so that was so fun, so exciting.
Have to. That's so great. Mm-hmm. Well, we're going to talk about goals of care, what it really means, and why these conversations matter, really how these conversations can help ensure that care is guided by what matters most to each patient. So when people hear the phrase goals of care, what does that mean?
Goals of care is something that we use a lot in the healthcare world. I don't really know how often, patients or families are hearing it or talking about it, but even within the healthcare world, it can be confusing, Mm-hmm. What it really is trying to capture is that, especially with chronic illness, and even without chronic illness, things can change and things can change quickly. And so if something happens, like we were able to walk and now we can't, we were decisional and now we're not decisional.
Your goals would change.
Your goals would change. We need to kind of circle the wagons, kind of figure out, okay, we're in a different place. Where are we going to go from here? Mm-hmm. What matters most to you today? What are we hoping for? What are we worried about? And that doesn't have to be kind of a black and white, we had a fall, we broke a hip. Mm-hmm. We're in a different, that's pretty clear. We got to figure out next steps. But even with, we thought mom was doing fine at home alone, but now she's in the hospital with a UTI and mom was not doing fine, at home alone kind of a thing. So it can even be, things have gradually changed and it maybe takes a little event or to kind of be like, let's talk about some things. We need to kind of get some things figured out. So I want to give an example of what a goals of care conversation might look like with a family. And I'll try to give like a light small one. Mm-hmm. It could be your dad is hard of hearing and he's stubborn and, he needs hearing aids, but isn't going to do it or hasn't done it or, blows you off, whatever. Mm-hmm. So how I like to start these is just a simple assessing understanding or just, Dad, what do you think is going on with your hearing? And it's pretty eye-opening. Sometimes, maybe your dad says, well, yeah, I'm really hard of hearing. Maybe he knows it. Or maybe your dad is like, no, well, everybody else seems to have a problem. I'm fine. I don't know why everyone, making a big deal about this. Then you can follow up with kind of a like one sentence, like headline, just get at the meat of the issue. Like, well, Dad, I'm not wanting to come over and spend time with you because I can't engage with you. And when I'm here, the TV is so loud that it's uncomfortable for me to be in this space.
Whoa.
And I worry I'm not going to be able to spend as much time with you as I'd like. Give it to him straight. Mm-hmm. This is the issue. This is the problem. This is where I'm at. There's
shouting at each other.
Yes. Yeah. And I'm uncomfortable with this kind of a thing. Mm-hmm. You can let him sit with it. You can provide, empathy. Like, I wish it were different. It's got to be so isolating, not being able to interact with, us. Mm-hmm. And aging has to be such a challenge, provide empathy and support in those ways. But then, ask him, this is kind of the heart of a goals of care conversation is what are his goals? So hopes and worries are what I asked, well, Dad, what worries you about getting your hearing checked? Mm-hmm. What's your worry? Mm-hmm. And then your dad could take that in any direction. Maybe it's, he's worried about spending the money, right? Maybe it's, he feels like a hearing aid is going to look silly.
Yeah.
Maybe he's worried he's going to spend the money, but the technology is overwhelming and he's going to break it or he's going to lose it or, whatever it is, it really brings to the surface, oh, okay, this is what we're worried about. And now we can kind of problem solve for that.
Right.
So my big takeaway, I would just say, if you can remember what are your hopes, what are your worries, asking that to your loved ones is really going to get you a long way.
Love it. Hopes and worries.
Mm-hmm.
Our goals are different when we're 20. I think back, or when I was 30,
mm-hmm.
right? And having babies and littles and 40 and now 50, so our goals change over time.
Yeah.
Mm-hmm. Yeah. So what do you think, why is it so important to have these conversations before a crisis would happen?
When a crisis happens and things, haven't been talked about or thought about, which is very, normal, very common. The family is the one that's kind of left holding the bag, having to make tough decisions. And it's kind of a twofold. There's the burden of kind of a guess, like, well, I do know Dad, and I think he would want this. But then there's this lingering, like, I think I'm making the right choice, but there's always kind of a question mark there. And then it also opens things up to, conflict, even about small things, but maybe siblings disagree on one thing or another, or things can be a little complex. Like maybe we're still legally married to someone that we've been separated from for a long time, but we're with a new partner.
Yes.
And if we haven't made arrangements or talked about goals or set things in place, then that partner that's been a faithful partner for the last 15, 20 years.
Maybe the caregiver,
might not get a say or wants a say that's different than what. Yeah, so things can get messy. And so that's why before a crisis happens, it's important to think through this and talk through this with your loved ones.
I hadn't thought of that. Each child or maybe a sibling has a different relationship with their parent in this scenario, right? Mm-hmm. So their goals may be very different. Mm-hmm. And by having these conversations and mapping it out may be a gift to the family. Is that?
Yeah, absolutely.
Okay.
Absolutely.
Yeah. So when you talk with patients, what do you hear about what matters most to them?
For patients, it's time with family. That usually is a huge one. Staying out of the hospital, it's such a pain to go in the hospital. It's physically draining, emotionally draining. I hear a lot of, they don't use the phrase quality of life, but it's things around quality of life, maintaining mobility, being able to, spend time with their dog or getting around in their home, staying at home. That's important to patients a lot. And, I also talk a lot of times, sometimes the patient can't make a decision. And so I'm having these conversations with their families. And so I'm asking things like, well, tell me about your dad. I hear a lot of very independent, very stubborn, things like that. And then when I ask, and then they always tell me a lot of cool stuff of like, well, if Dad were here, what would he say? And that also really can help families to kind of get at, this is what my dad would want, or this gets them in the right frame of mind.
And it's ideal that you can have those with the patient, because I would think it's hard to separate what Dad would want when you're the caregiver, because it impacts you. So it might be what you want. Might be different than what Dad would want, and what might be realistic. In terms of the care that can be provided with resources and all those things. What impact do you think these conversations have, with loved ones? What have you seen with our families and folks that we've been caring for? Is there a story you can share?
Yeah. So as far as impact that goals of care conversations have on loved ones, it's a loaded question. I will say many times it's wonderful. The family, the patient, the care team, everybody knows what's going on. Everyone has a good understanding. Everyone's in agreement with, yes, this is the plan. This is how we're going to move forward. It aligns with everyone's goals. But there are plenty of times where things might be in conflict. Social situations can be complex, family dynamics. An example of this would be, maybe your uncle insists on going home and you're like, you can't get to the bathroom. Why are we trying to go home?
Right.
And so a goals of care conversation, we can all sit down together, healthcare team, family, patient, and talk about, okay, goal is to go home. Worry is how things aren't safe there.
Yes.
And so then the focus shifts to how can we compromise? Uncle would have a choice and a decision and the right to try and fail. He has a right to make what some people, would feel would be a bad decision or an unsafe decision. So then we focus on what can we put in the home? How can we make this a better situation? How can we compromise? Because of course, family. So maybe it's personal care.
Yeah.
Maybe it's hospice, coming into the home multiple times a week, really, great support, to help keep him at home. Maybe it's a baby monitor, that has an app on the phone for nephew to kind of take a look multiple times a day. Like, all right, we made it to the bathroom that time. Didn't look great, but we're back in the recliner. Or, okay, no, we need to send somebody out. He fell, that kind of a thing. Maybe it's Meals on Wheels. Just anything. Like if we're hearing that the goal is independence, then that's what we can work on and focus on, is maintaining that for as long as possible and doing it in a way where so that nephew might walk away from that goals of care conversation with, this is not the outcome that I wanted. I still don't feel like this is super safe. But my goal as a physician is to help family walk away being like, all right, well, we can try it,
I just had a thought. A friend of mine just walked through this scenario. It's almost, I remember her calling and saying, Steph, we have a map. And I thought, oh, that's so true. Goals of care conversation is a little bit of a map.
Yeah.
But the frustrating part can be that it changes over time as, the patient needs change, right?
Yep.
Care needs change.
Yep.
So how often do we have those conversations?
Yep. That's a great question. It is a moving target. And this, I think, is a great opportunity to kind of speak to hospice and how hospice can kind of protect and honor a person's goals of care.
Okay.
It's because hospice starts with the goals of care conversation. You're not really going to get to hospice without it. So I think that just kind of sets the stage for success when it comes to honoring and maintaining goals. With our, hospice team, we are so present. You've got someone coming into your home multiple times a week. We have a small team that really gets to know you. You have your nurse, you have your home health aide. So they get to know you kind of longitudinally over time and get to really understand what is important to you, what matters most. And your team has seen it before. You're not the first person that they've walked with through the last months of life. And what that helps is we can meet the moment.
They can see signs and symptoms of change and start guiding maybe another conversation.
Yeah, we can hit the moving target. So examples would be maybe last week, the goal was cousin's coming over and we're going to get our nice outfit on. We're going to get our hair done. We're going to, put our makeup together and sit in the recliner to have a good visit for cousin.
Right.
This week, maybe we're feeling a lot better, and we want to go outside. We want to watch the bird feeder, for a while, and we're going to make that happen. And then maybe tomorrow is a bad day and we just want to be cozy in bed. We don't want visitors. We just want to rest. And so hospice is so great as far as, but you're right, goals of care conversations and goals change daily, hourly, weekly, monthly, all the time. And as time gets shorter, so often it changes even more quickly.
Yeah. And that extra level of support, in this case, you were talking about a hospice. It could be personal care. There's that advocate. There's that person day to day that's watching out for you, helping to communicate with loved ones, right, about those changes and then making, being able to pivot and say, here's what we can do to help support that. Yeah. But, if someone was listening and they haven't had this conversation yet, what's the first step you'd encourage them to take?
Yeah, there's a lot of great resources out there. I mean, by listening to this podcast, you've started out, this is a great resource. We also have, if you want to look for more granular, detailed, language to use, our second episode titled, How Do You Even Begin, has some good examples in there for you to kind of just take a listen to that. There's also 5 Wishes. It's a booklet, pretty popular. You might have heard of it before, but if you haven't, it's a free resource. We'll link it in the show notes. It kind of is a great guide to help you walk through, what do I need to ask, or, what decisions need to be made, or just surrounding goals of care and what if there was a crisis, what do you want me to say if you can't speak for yourself? And then, as always, talk to your healthcare team, your doctors, social workers, your spiritual leaders. That will all help you and your family kind of flush out what matters most.
Perfect. There's one more thing. I'm wondering because, I see it. I see it here in our inpatient unit and I see it in our own family. If families don't necessarily see eye to eye, how can this goals of care tool help manage and navigate that?
Yeah, so goals of care a lot of times also looks like family meetings, and it really allows for family members to kind of say there are different pieces in a controlled environment. And then also it kind of allows them to sort of come to the realization too that especially if they don't see eye to eye with the patient, at the end of the day, it's the patient's decision.
Right.
And that can feel icky. That can be a bummer. That can also be a relief. That can be, oh, thank goodness, I didn't want to make that call. I'm happy mom made that call. But then it also allows too for, if sibling, one sibling is a caregiver, has a different perception of what's going on from a, sibling that lives maybe far away, helps them, get, if they don't get on the same page, get closer, to kind of the same page. So
before crisis. So good. Well, this is Better Together podcast, dedicated to making every moment count. Thank you for listening. Please like us and share on your social media channels. If you have a question you'd like to learn more about a specific topic, you can find us on our website at ourhospice.org or call 812-314-8083. Until next time, remember, life is short. We are better together, making every moment count.